This is the Coronavirus Daily Briefing for Friday, March 20th, 2020. I'm Jackson Bird, filling in for Brian McCullough, who will have a quick message at the end of the show. Testing continues to be chaotic in the U.S., but are tests more easily accessible for the wealthy and famous? The CDC recommends last resort options for healthcare workers running out of masks. Younger people are getting sicker than previously anticipated, and an update on how long COVID-19 will live on surfaces and in the air. It was just, yesterday, the day before, when we reported that the 200,000 global case number was surpassed. Well, this morning, the number of global cases passed 250,000. It took 3 months to reach 100,000 cases worldwide, but only 12 days to log an additional 100,000. These are how these numbers are going to go for the future. We could reach a point in a matter of days where we are adding 100,000 cases a day. This is just how these numbers will work for the time being. The U.S. has doubled the number of confirmed cases in 2 days. All the numbers will be going like this. Spain has reported 1,903 new cases, bringing the total number of cases in that country to just shy of 20,000, with 800 deaths. Even countries that haven't seen comparatively many cases yet have been reporting spikes. Belgium reported 462 new cases and 16 new fatalities. Deaths in Italy have reached 3,405, marking more people than have died in China since the crisis began, and morgues in Italy are reportedly running out of space. At the time of this recording, New York City alone has reported 2,275 new cases for a total of 3,615. But again, if you think this is remote from you, the state of Michigan reported 254 new cases yesterday, bringing its total case number up to 334 cases in a single day. The entire state of California has gone into an Italy-style lockdown. Quoting the New York Times, Governor Gavin Newsom on Thursday night ordered California's almost 40 million residents to stay home except for essential trips, extending similar restrictions statewide that Bay Area counties had previously enacted. The order, which is in place until further notice, exempts travel to essential services like grocery stores, pharmacies, and gas stations. In large swaths of the state, non-essential businesses like movie theaters, gyms, and bars had recently been ordered to close. Restaurants have been limited to takeout or delivery only. This is not a permanent state. This is a moment in time, Mr. Newsom said in a news conference. We will look back at these decisions as pivotal. End quote. More than 2,000 members of the U.S. National Guard have been activated in 27 states, and more are likely to be called up this weekend. The State Department urged American citizens abroad to return home and told Americans not to travel abroad by raising its global travel advisory to level 4, the top-tier warning. Quoting the Washington Post, Vice President Mike Pence said new legislation will allow tens of millions more protective masks to reach U.S. healthcare workers each month, beginning immediately, but it was still unclear whether total production will be enough to meet demand. The legislation, signed Wednesday, provides manufacturers of N95 face masks protection against lawsuits when selling certain masks to healthcare workers, Pence said. That will free producers including 3M and Honeywell to sell tens of millions more masks per month to hospitals, Pence said. The change means Minnesota-based 3M will now be free to sell 420 million masks a year to the U.S. healthcare sector, Pence said. And Honeywell of Charlotte, North Carolina will soon boost N95 mask output in the U.S. by an additional 120 million masks per year, he added. Those figures are still well short of the 3.5 billion N95 respirator masks the U.S. could need in a serious pandemic, an estimate Robert Kadlec, an assistant secretary at the Department of Health and Human Services, gave at a Senate hearing this month. Quoting the New York Times, the Open Cities Community Health Center in St. Paul, Minnesota is considering shutting its doors because of a dwindling supply of face masks. Doctors at Barnes Jewish Hospital in St. Louis have been forced to perform invasive procedures with loose-fitting surgical masks rather than the tight respirator masks recommended by health agencies. At one Los Angeles emergency room, doctors examining a suspected coronavirus patient were given a box of expired masks. When they tried to secure them to their faces, the elastic bands snapped. End quote. A 34-year-old California man became one of the youngest victims in the U.S. when he died yesterday. Jeffrey Gazarian had survived prostate cancer recently. People who have undergone cancer treatments are especially vulnerable to respiratory infections. China has recorded no new local cases for a second day in a row, but 39 new cases overall, all of them imported from abroad. An update now on testing in the U.S. There remains a patchwork of access to testing and testing capabilities across the country. New York State is now capable of testing thousands of samples per day. On Thursday, it reported testing 7,500 people and is making testing widely available to those who get sick, while other areas remain stymied by lack of testing kits and/or processing chemicals and are therefore limiting testing access to the sickest patients only. Together with social distancing, testing has been key to curbing the growth of new cases elsewhere around the globe, most notably in South Korea. Now, several weeks into this outbreak in the U.S., it appears the capability to run a large number of tests across all parts of the country remains woefully inadequate. Calling the situation chaos, the Wall Street Journal reported that Colorado, limited to testing 250 samples per day, has moved a mobile testing unit from Denver to Telluride and has no plans to reopen a testing facility in the capital. Quoting from the Journal's report, after initially offering widespread testing, Minnesota officials retrenched Tuesday, limiting testing to healthcare workers, inpatients at hospitals, and people in group living facilities. Chris Arisman, commissioner of the Minnesota Health Department, said high demand made testing everyone who might be infected impossible. Quote, reserving these laboratory tests for the sickest individuals is the right thing to do, she said. The state was forced to freeze 1,700 samples due to a shortage of supplies, Governor Tim Walz said Wednesday. We don't have testing capacity, he said. On Wednesday, South Dakota Governor Kristi Noem said its state lab was forced to temporarily stop processing tests because it ran out of the necessary supplies. Ms. Noem said that they have been trying for weeks to get more of the chemicals used to process the tests from suppliers and had asked Vice President Mike Pence to help. End quote. Federal health officials have told Congress that they're continuing to increase the supply of test kits to states and are trying to support localities in opening more drive-through testing sites, like the one opened in New York State in the New Rochelle hotspot. But it remains clear that the president's claim on March 6th that anybody who wants a test gets a test is simply not the case in much of the country. Anybody who wants a test gets a test might not be true for most of the country, but some people online are beginning to wonder if the truth is that anybody rich and famous enough who wants a test gets a test. While stories continue to emerge about medical facilities lacking the supplies to process tests and symptomatic individuals unable to access testing, more and more celebrities, politicians, athletes, and influencers are announcing that they've tested positive for COVID-19, making some people raise their eyebrows. Quoting the New York Times, with testing still in short supply in areas of the country, leaving healthcare workers and many sick people unable to get diagnoses, some prominent personalities have obtained tests without exhibiting symptoms or having known contact with someone who has the virus as required by some testing guidelines. Others have refused to specify how they were tested. Such cases have provoked accusations of elitism and preferential treatment about a testing system that has already been plagued with delays and confusion. End quote. One example is the NBA, where 8 entire teams have been tested. After 4 Brooklyn Nets players were tested, Mayor de Blasio tweeted, "We wish them a speedy recovery, but with all due respect, an entire NBA team should not get tested for COVID-19 while there are critically ill patients waiting to be tested. Tests should not be for the wealthy, but for the sick." End quote. Not all teams are blanket testing, however. Coach Bob Myers of the Golden State Warriors said that only symptomatic players, coaches, and staff would be being tested because they're aware that tests are in short supply, and he recognized that, quote, "We're not better than anybody, not worse, just a basketball team." Adam Silver, the NBA commissioner, noted in an interview recently that the Utah Jazz and Oklahoma City Thunder teams were tested at the behest of public health officials, not the NBA, and weren't even allowed to leave the locker room until they were. While several U.S. senators and representatives who have tried to get tested have been advised not to unless they are symptomatic, a few allies of the president's, such as Senator Lindsey Graham and Representative Mark Meadows, have been able to get access to tests, though, as Representative Matt Gaetz, who also got tested, pointed out, it wasn't because he's in Congress, but because, quote, "I had been in close contact with President Trump over several days." Some celebrities and influencers who have spoken out about being unable to get tested at first have posted follow-ups shortly thereafter announcing their results. Like Ariel Charnas, an Instagram influencer with over 1 million followers who was experiencing symptoms and unable to get tested, but after tagging Dr. Jake Deutsch, the founder of Cure Urgent Care, in a post, was able to get tested by him. Charnas shared the process of getting tested and her ultimately positive results, along with a recognition of her privilege in accessing care. Some people argue that Charnas is setting a good example for the public of taking the coronavirus seriously, outweighing the imbalance of access. But others, like Dr. Uche Blackstock, an urgent care doctor in Brooklyn, are less impressed. Quoting Blackstock's Twitter, "It's upsetting to me to 1, have to ration out COVID-19 testing to my patients, then 2, have to wait 5 to 7 days for the results when celebrities are getting tested with ease and quick turnaround times." End quote. Healthcare workers treating coronavirus patients are being advised to use homemade face protection when face masks run out. The Washington Post reports that major hospitals in Seattle and Washington, D.C. are experiencing mask shortages so severe that, quote, doctors and patients were being asked to reuse the masks, not dispose of them as previous traditional CDC protocol requires, even after contact with infected patients, end quote. The paper reports millions of masks have been requested by hospitals all over the country. Now, the CDC is altering its advice to healthcare personnel to take these shortages into account. In measures it describes as, quote, strategies not commensurate with U.S. standards of care, CDC recommends that in settings where face masks are not available, healthcare personnel might use homemade masks, e.g. bandana, scarf, for care of patients with COVID-19 as a last resort. However, homemade masks are not considered personal protective equipment since their capability to protect healthcare personnel is unknown. Caution should be exercised when considering this option. Homemade masks should ideally be used in combination with a face shield that covers the entire front, that extends to the chin or below, and the sides of the face. End quote. The CDC notes that this should happen only after all other face mask preservation strategies, including using them beyond the manufacturer's specified shelf life, and even, as is reportedly happening in Seattle and DC already, reusing masks despite the potential danger of surface transmission of the virus. Nicole Lurie, Assistant Secretary for Preparedness and Response at HHS during the Obama administration, told the Washington Post that this new CDC advice should be a, quote, wake-up call, adding, the bottom line is, if you cannot protect healthcare workers and they get sick, the whole system goes down. The priority to maintain public health is to protect healthcare workers. End quote. New data from the CDC says that so far in the U.S., younger people are making up a larger portion of COVID cases requiring hospitalization than officials had anticipated. 40% of patients sick enough to require hospitalization in the U.S. have been between 20 and 54 years of age. 20% of hospitalized patients and 12% of intensive care patients were between the ages of 20 and 44, basically the millennial generation. Quoting the New York Times, the report, issued Wednesday by the Centers for Disease Control and Prevention, found that, as in other countries, the oldest patients had the greatest likelihood of dying and of being hospitalized. But of the 508 patients known to have been hospitalized, 38% were notably younger, between 20 and 54. And nearly half of the 121 patients who were admitted to intensive care units were adults under 65, the CDC reported. I think everyone should be paying attention to this, said Stephen S. Morse, a professor of epidemiology at Columbia University's Mailman School of Public Health. Quote, it's not just going to be the elderly. There will be people age 20 and up. They do have to be careful even if they think they're young and healthy, end quote. The report didn't say whether hospitalized patients of any age had an underlying condition, but the fact that younger patients are needing the hospital and intensive care beds is an important development. Dr. Deborah Birx, responding at a White House press conference to reports of younger people in France and Italy requiring hospitalization, asked young Americans to stop congregating in groups immediately, noting that if younger people, who may have mild or no symptoms, continue to disregard the warnings, quote, you have the potential then to spread it to someone who does have a condition that none of us knew about and cause them to have a disastrous outcome.
Businesses of all sizes, these are potentially difficult times, of course. So right now, any tools that can help keep operations running are more than welcome. Stamps.com is one of those tools because it can help you keep your shipments and business-critical correspondence going. Anything you could do by going to the post office, you can do without going out, simply by going to Stamps.com. Stamps.com brings all the services of the U.S. Postal Service right to your computer. Whether you're a small office sending invoices, an online seller shipping out products, or even a warehouse sending thousands of packages a day, Stamps.com can handle it all with ease. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier or drop it in a mailbox. It's that simple. Plus, you get discounts with Stamps.com that you can't get at the post office. So stay indoors, but stay in business as well with Stamps.com. Right now, our listeners get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com. Enter briefing for your free trial, BRIEFING. Stamps.com, enter briefing.
On Monday, Brian shared how long the coronavirus can live on surfaces. And in case you missed it, the latest studies, which are not yet peer-reviewed, so keep that in mind, found that coronavirus was, quote, most stable on plastic and stainless steel, end quote, with viable virus being detected up to 72 hours after application. It can remain viable for up to 24 hours on cardboard and 4 hours on copper. However, a new study published Wednesday in the New England Journal of Medicine suggests, quoting the New York Times, when the virus becomes suspended in droplets smaller than 5 micrometers, known as aerosols, it can stay suspended for about a half hour, researchers said, before drifting down and settling on surfaces where it can linger for hours. The finding on aerosol in particular is inconsistent with the World Health Organization's position that the virus is not transported by air. End quote. While the WHO has said the virus is not airborne, they've also advised healthcare workers to assume that it is, for just this reason. Quoting the New York Times again, the virus does not linger in the air at high enough levels to be a risk to most people who are not physically near an infected person. But the procedures healthcare workers use to care for infected patients are likely to generate aerosols. End quote. Dr. Lindsay Marr, an expert in the transmission of viruses by aerosol at Virginia Tech in Blacksburg, said, "It sounds scary, but unless you're close to someone, the amount you've been exposed to is very low." Continuing from the New York Times, quote, Dr. Marr compared this to cigarette smoke or a foggy breath on a frosty day. The closer and sooner another person is to the exhaled smoke or breath, the more of a whiff they might catch. For anyone farther than a few feet away, there is too little of the virus in the air to be any danger. End quote. Several research teams are continuing to do studies on the aerosol viability of the virus, but Dr. Vincent Munster, a virologist at the National Institute of Allergy and Infectious Diseases, notes that so far there's no indication that COVID-19 is any more capable of surviving in the air than SARS or MERS.
This is Brian back with you real quick to sign off this week with this note. I really think that this weekend into early next week is when the storm is really going to hit the U.S. Yes, there are hopeful signs. We do try to share signs of hope with you, along with all of the frightening stories. China seeing no new local cases for 2 days in a row. At least at the time of this writing, new cases in Washington state have remained at the same level roughly for 3 days. The numbers in Spain, while horrific, do seem to be leveling off a bit as well. But what I want to point out is that all of those places that I just mentioned have already put into place at least some form of social distancing, if not full lockdowns. And if those numbers are good or starting to trend good, it's only because some measures have been put into place and they're starting to work. So if there's a sign of hope, it is that social distancing can work, and we're just getting started doing it now. Social distancing can do something, and something is better than nothing. That's the best we have right now. That is why I think you're seeing things like the entire state of California going into lockdown. That is why I say these next few days are probably when the storm is going to hit. I think local officials are seeing the numbers, extrapolating from the numbers, and realizing the time is nigh, and that's why you're seeing these sudden measures. If there is one thing I want you to take away from all that, it is this. The weekend is here. Take this opportunity, if you've not already done so, to stay home. Do not go out this weekend if you can avoid it. Do not go into work on Monday if you can avoid it. Let me read you 2 tweets that sum up where we are at this moment in time. The first is from Noah Smith, the finance and economics columnist at Bloomberg. Quote, "The craziest thing about coronavirus is that if we do manage to hold deaths down to like 50,000 or so in the US, people will say, see, it's just like the flu, and you made us go through all that. But if we don't hold down deaths, it will be an epic, historic catastrophe," end quote. And this is from Jeremy Young, a history professor at Dixie State University. Quote, "If suppression actually works, it'll feel like we're doing all of this for nothing because infection and death rates will remain low. It's easy to get people to come together in common sacrifice in the middle of a war. It's very hard to get them to do so in a pandemic that looks invisible precisely because suppression methods are working. But that's exactly what we're going to have to do," end quote. To politely disagree with the professor, this is a war. Stay home. That's what you can do about it. Let them call you crazy for staying home. If and when the numbers don't turn out to be as bad as they are looking at this moment in time, let them call you crazy for overreacting. Be confident in your heart of hearts that things didn't turn out as bad as they could have because you did the right thing for your family and your country. You stayed home. Right now, there are still a ton of people that would call me crazy for relaying this message to you. But I'll take that. I'll take people thinking I was wrong if it means that overreacting was right all along, because that would mean that people's lives would have been saved.
As always, this show was produced by Ride Home Media, written by James Welsh, Brian McCullough, and myself, Jackson Bird, edited by James Welsh. If you are finding this show useful, please share it with your friends and family, or leave a review to help other people find it as well. Have a good weekend. Stay in. Brian will be back on Monday. Be well.